Hi, I'm going to be performing the skill ophthalmic medication administration today. I want to let you know before I begin, I normally do not have on nail polish, but I had a special event to attend, so I do. For the sake of the video, I'm going to perform as if I do not have any nail polish on. I'm also a bit under the weather, so please bear with me if I have to catch my breath or if I cough or, you know, yeah, or if my breathing is a little bit off, okay? I'm going to begin by verifying the doctor's orders. I'm going to verify the 6 rights of medication administration, which are the right patient, right drug, right dose, right time, right route, and right documentation. I'm then going to check the medication order in the EHR. I'm going to check the medication against the order. I'll do this 3 times, this being the first time for safety, for the safety check, okay? And it looks like the doctor has ordered Timolo, 25%, and that's 0.25% solution. I'm going to, with 1 drop in each eye twice a day. Okay? I will begin by introducing myself to the patient. Knock, knock, knock. Hi, my name is Trina. I'm going to be your nurse for today. I'm going to provide my patient with privacy. I'm going to wash my hands. And using 2 identifiers, I'm going to look at his wristband. And can you verify your name and date of birth for me, please? Thank you, Mr. Burton. I'm going to then check the medication in the EHR, look for his name, and verify the medication against the order. That's going to be my second check. Okay. And Mr. Burton, how are you today? Wonderful, wonderful. Mr. Burton, I'm going to ask you a few questions. Do you have any allergies of any sort? Like allergies to food, medication, environmental issues? No? Okay, wonderful. Thank you for that, Mr. Burton. And Mr. Burton, just so you know, the reason I'm here is because your doctor has prescribed some ophthalmic medication for you, which is eye medication. Okay, the medication that he's ordered for you to receive is to treat your glaucoma. It's called Timolo. I'm going to be administering 1 drop in each of your eyes. Okay, and just so you know a little bit about Timolo, is Timolo is used to treat your glaucoma, as I said before. It's used to treat your glaucoma. It is a beta blocker, which will help reduce that stress that you're feeling in your eye. All right. Also, some common side effects that you may experience with this medication would be dry eyes. You may experience watery eyes, and you could also experience a little itchiness in your eyes. All right. Some adverse effects, and these are effects that you definitely want to report to me right away, that you could experience would be irregular heartbeat, and you could also experience extreme fatigue as well. Okay. So if any of those symptoms happen, make sure you report them right away. All right. Also, another thing when I administer the medication, you could feel a little stinging and stinging sensation and also some burning. Okay, if that should happen, let me know. All right. So, do you have any questions for me, Mr. Burton? Okay, wonderful. All right. Mr. Burton, before I begin, let me check the computer system one more time. And this is going to be just so you know, this is going to be my third check, checking the EHR, medication, okay? And so it's the correct medication. So I'm going to begin. I'm going to wash my hands. I am going to put on my gloves. They're a little bit snug. Okay. And Mr. Burton, I'm going to ask you to lay in a supine position. So lay back so you can get comfortable, and so it'll be easier for me to administer the eye drops for you, okay? All right. And so I'm going to lay you back, and I'm going to raise the bed up. I'm going to lower the rails. And Mr. Burton, it looks like you have a little bit of crust in your eye. So what I'm going to do is I am going to clean that crust out. I'm not going to put any pressure on your eyeballs at all, or your eyes at all. But I am going to clean with a clean cloth. And I'm going to just clean it at an angle. I'm going to go from the inner canthus to the outer canthus. All right. I'll dispose of that tissue. And then I'm going to go on the other side from the inner canthus to the outer canthus and dispose of that as well. Does that feel better? Okay. And I'm going to remove my gloves. Dispose of them. Dispose. And now I'm going to administer the medication for you, Mr. Burton. Now, while I'm administering, before I begin, I want to let you know that while I'm administering the medication, please do not blink. Do not close your eyes. I'm going to ask you to lift your look up when I administer each eye drop, before administering each eye drop. I'm only going to put the eye drops in the, I'm only going to put the eye drops. I'm not going to put them on the outlet. I'm just only going to put them on the conjunctival sac, okay, of each eyeball, all right? I'm going to ask you to look up when I do it, all right? And I'll just wash my hands again, put on my gloves. Please bear with me. These gloves act as if I did not touch the glove on the outside. Gloves are a little bit snug. And this is the clean tissue that I'll be using. Okay. And Mr. Burton, I'm gonna get ready to administer your eye drops. Okay. I'm gonna press down on the bony orbit of your cheekbone gently. And this is with my non-dominant hand. I'm gonna press down, and then I'm gonna rest my dominant hand on your forehead. I'm going to pull down on your cheekbone, exposing the conjunctival sac. I'm going to come down 1 to 2 inches right above the conjunctival sac, and then I will administer the eye drop, and that's going to be drop. All right, that eye is good. Do not blink. Don't close your eye. Okay, now I'm going to do the other eye the same way. I am going to pull your cheekbone, pull down on your cheekbone on the bony structure, exposing your conjunctival sac. I'm going to come 1 to 2 centimeters and release the eye drop. Drop. Okay. And I will dispose of that tissue. Now I am going to go to the corner of your eyelid and near your nasal lacrimal duct, and I am just going to hold for 30 seconds, and that's going to be 30 to 60 seconds. I'm going to hold, making sure I don't touch the eyeball. Okay. And this helps to prevent any systemic effects that you may have. Okay, 60 seconds. I'm going to do the same thing for the other eye, and this eye you can slightly close it for a second. Okay, I'm going to do the same thing for the other eyeball. Just going to the nasal lacrimal ducts, press in gently. Okay. And blink for me. All right. And I'm going to dispose of that. And how do you feel? Okay. Any burning, any itching, anything? Wonderful. And I'm going to dispose of everything. All right. Dispose of my gloves. I'm going to sit you back up. I'm going to lower your bed. All right. And I'll be back in to check on you. All right. How do you feel? Okay, wonderful, wonderful. All right, and I'm going to wash my hands. And Mr. Burton, if you feel any uneasiness, any complications, please don't hesitate to give me a call. Here's your call light. Here's your call light. And you have a good day. Dispose of all my trash, and I'm going to perform my documentation, and you have a wonderful day.